Glaucoma, a comprehensive overview. Glaucoma is a progressive condition that adversely affects the optic nerve, leading to deterioration over time. Typically associated with an increase in intraocular pressure, glaucoma often has a hereditary inclination, with manifestations usually appearing later in life. The elevated intraocular pressure can inflict damage on the optic nerve, responsible for transmitting visual signals to the brain. As the damage advances, glaucoma may result in irreversible vision loss or even complete blindness within a relatively short period. Significantly, individuals with glaucoma often do not experience early symptoms or pain. Regular visits to an eye doctor are essential for timely diagnosis and intervention to prevent long-term vision impairment. Causes of glaucoma: the fluid, known as aqueous humor, normally exits the eye through a mesh-like channel. If this channel becomes blocked or the eye produces excessive fluid, a buildup occurs. While the precise cause of this blockage is sometimes unclear, it can be hereditary. Other less common causes encompass blunt or chemical eye injuries, severe eye infections, blocked blood vessels, inflammatory conditions, and occasionally, eye surgery for unrelated issues. Risk factors for glaucoma: while glaucoma is more prevalent in adults over 40, it can also affect young adults, children, and infants. African Americans face a higher risk, experiencing the condition earlier and with more pronounced vision loss. Individuals with the following characteristics are more susceptible to glaucoma: African American, Irish, Russian, Japanese, Hispanic, Inuit, or Scandinavian descent. Age over 40. Family history of glaucoma. Nearsightedness or farsightedness. Poor vision. Diabetes. Use of specific medications, for example, prednisone, drugs for bladder control or seizures, certain over-the-counter cold remedies. Previous eye injuries. Thinner than usual corneas. High blood pressure, heart disease, diabetes, or sickle cell anemia. Elevated eye pressure. Regular comprehensive dilated eye exams are vital, especially for those in high-risk groups, such as African Americans over 40, individuals over 60, particularly Mexican Americans, and those with a family history of the disease. Hereditary aspect of glaucoma. Glaucoma can have a hereditary component, particularly when a first-degree relative, parent, sibling, has the condition. Certain gene mutations have been identified as contributors to glaucoma development. Types of glaucoma. Two primary types of glaucoma exist. Open-angle glaucoma, the most prevalent type, characterized by normal-appearing drainage structures, but impaired fluid outflow. Angle closure glaucoma, more common in Asia, it involves inadequate drainage due to a narrowed space between the iris and cornea. This type is associated with farsightedness and cataracts. Less frequent variations include secondary glaucoma, normal tension glaucoma, pigmentary glaucoma, and congenital glaucoma in infants. Symptoms of glaucoma. Symptoms of open-angle glaucoma typically emerge late in the disease, often resulting in peripheral vision loss. Angle closure glaucoma symptoms manifest more rapidly and prominently, potentially causing vision loss. Halos around lights, eye redness, haziness, nausea, and severe headaches. The feeling of glaucoma, except for acute angle closure glaucoma, is generally not noticeable, especially in the early stages. Acute angle closure glaucoma symptoms, on the other hand, include severe eye pain, redness, headaches, blurred or foggy vision, halos around lights, dilated pupil, and nausea/vomiting. This type demands immediate medical attention to prevent irreversible vision loss. Diagnosis of glaucoma. Elevated eye pressure alone does not guarantee the presence of glaucoma. It could be ocular hypertension without optic nerve damage. Glaucoma tests, which are painless and brief, include dilated eye exam, gonioscopy, optical coherence tomography, OCT, ocular pressure test, tonometry, pachymetry, slit lamp exam, visual acuity test, visual field test, perimetry. Treatment of glaucoma. The treatment of open-angle glaucoma often involves a combination of eye drops, laser trabeculoplasty, and microsurgery. Medications, typically administered through eye drops, either reduce fluid production or enhance outflow, effectively lowering intraocular pressure. Oral medications may also be prescribed to improve drainage or reduce fluid production. Laser surgery, such as trabeculoplasty and iridotomy, can be employed to augment fluid flow or alleviate blockages. Microsurgery, specifically trabeculectomy, involves creating a new drainage channel to reduce eye pressure. Minimally invasive glaucoma surgeries, a newer and less invasive approach, use tiny incisions, and often accompany other procedures like cataract surgery. Acute angle closure glaucoma constitutes a medical emergency and is primarily treated with laser procedures to prevent irreversible optic nerve damage. Congenital glaucoma in infants typically necessitates surgical intervention due to a congenital drainage system malfunction. Living with glaucoma, tips and recommendations. Glaucoma necessitates lifelong management and regular follow-ups with an eye doctor. Adopting a healthy lifestyle can complement medical intervention. Engage in regular exercise to potentially lower eye pressure and promote optimal blood flow to ocular nerves. Maintain a nutritious diet rich in antioxidants, incorporating dark, leafy greens and omega-3 fatty acid-rich fish. Adhere to prescribed medications diligently, setting reminders to avoid lapses in treatment. Exercise caution with contact lenses, considering potential medication interactions and vision prescription changes. Quit smoking to mitigate increased blood pressure and eye inflammation risks associated with glaucoma. Monitor caffeine intake, as excessive consumption can elevate eye pressure. Elevate your head while sleeping with a wedge pillow to potentially reduce eye pressure. Consume fluids gradually throughout the day to avoid straining the eyes. Protective measures such as wearing eyewear during specific activities, using non-allergenic makeup, and wearing sunglasses outdoors can safeguard sensitive eyes. Resisting the urge to rub itchy eyes due to glaucoma or medication-induced dryness is crucial. Consult with your doctor before using drops for dryness. Driving is usually permissible for most individuals with glaucoma, subject to meeting vision test requirements. Advanced glaucoma may warrant license renewal with restrictions. Exercise caution with certain yoga positions that may elevate eye pressure, especially if prone to glaucoma. Positions like downward facing dog, standing forward bend, plow, and legs up the wall might be reconsidered. Supporting a parent with glaucoma. A glaucoma diagnosis can be daunting, especially for older individuals contending with various age-related challenges. Offering reassurance and helping establish a routine for administering eye drops, particularly for those with arthritis, can be invaluable. Additionally, aiding in surgery preparation and organizing transportation for follow-up appointments contributes to effective management. Numerous services and products cater to individuals with impaired vision, facilitating tasks such as writing checks, organizing spaces, and telling time. Organizations like the Glaucoma Foundation offer valuable resources. Ultimately, emotional support remains paramount in helping a loved one cope with glaucoma. Preventing glaucoma. While glaucoma is not preventable, early detection significantly mitigates the risk of irreversible eye damage. Key preventive measures include regular eye exams, with all adults advised to undergo glaucoma screenings every 3 to 5 years. More frequent eye exams, every 1 to 2 years, for individuals over 40 with a family history of glaucoma or those with health conditions like diabetes. Inquiring about family history to assess genetic predisposition. Adhering to doctor-prescribed instructions, especially if high eye pressure is detected. Incorporating regular moderate exercise into the routine. Wearing protective eyewear during sports or home improvement activities. Lifestyle modifications for glaucoma management. Stress management. Chronic stress not only affects mental health but can also impact eye health, potentially exacerbating glaucoma symptoms. Incorporating stress management techniques into daily life is crucial. Practices such as meditation, deep breathing exercises, and yoga have been shown to reduce stress levels and contribute to overall well-being. Encourage individuals with glaucoma to explore these practices and find what works best for them. Nutritional guidance. A well-balanced and nutrient-rich diet is essential for maintaining overall health, including eye health. Provide guidance on foods that are particularly beneficial for the eyes. Emphasize the inclusion of foods rich in antioxidants, such as dark leafy greens, kale, spinach, fruits, berries, oranges, and vegetables, carrots.
Vitamins A, C, and E play a crucial role, so individuals should be encouraged to include sources
like sweet potatoes, citrus fruits, nuts, and seeds in their diet. Additionally, minerals like zinc, found in foods like lean meats and legumes, can support eye health. Hydration. Adequate hydration is fundamental for overall health, and it extends to eye health as well. Proper hydration helps maintain the balance of fluids in the eyes. However, individuals should be mindful of their fluid intake to avoid excessive strain on the eyes. Sipping water throughout the day is preferable to consuming large amounts at once. This can help prevent dehydration without causing discomfort or eye strain. Screen time management. With the prevalence of digital devices, prolonged screen time has become a common concern for eye health. Extended exposure to screens can contribute to eye fatigue and discomfort. Implementing the 20-20-20 rule is a practical strategy for managing screen time. Every 20 minutes, individuals are advised to look at something 20 feet away for at least 20 seconds. This simple rule helps reduce eye strain and allows the eyes to rest, preventing potential complications associated with prolonged screen use. Encourage the use of blue light filters on screens, as they may further alleviate strain. Regular physical activity. Engaging in regular exercise has numerous health benefits, including potentially lowering intraocular pressure. Moderate physical activity, such as brisk walking or jogging, can contribute to overall well-being and eye health. Encourage individuals to consult with their healthcare provider to determine a suitable exercise routine tailored to their specific needs and health condition. Adequate sleep. Quality sleep is essential for overall health and plays a crucial role in maintaining eye health. Encourage individuals to establish a consistent sleep routine, ensuring they get an adequate amount of rest each night. Quality sleep supports the body's natural healing processes and contributes to overall eye health. FAQs, frequently asked questions. Glaucoma. What is glaucoma? Glaucoma is a progressive condition that affects the optic nerve, leading to deterioration over time. It is often associated with increased intraocular pressure and can result in irreversible vision loss or blindness. Are there early symptoms of glaucoma? Individuals with glaucoma often do not experience early symptoms or pain. Regular visits to an eye doctor are crucial for timely diagnosis and intervention to prevent long-term vision impairment. What are the causes of glaucoma? Glaucoma can be caused by a blockage in the mesh-like channel through which aqueous humor exits the eye. Hereditary factors, eye injuries, infections, blocked blood vessels, and inflammatory conditions can contribute. Who is at a higher risk of developing glaucoma? Risk factors include age over 40, family history of glaucoma, certain ethnic backgrounds. African American, Irish, Russian, Japanese, Hispanic, Inuit, or Scandinavian descent. Nearsightedness or farsightedness, poor vision, diabetes, and high blood pressure, among others. What are the types of glaucoma? There are two primary types: open-angle glaucoma, more prevalent, impaired fluid outflow, and angle closure glaucoma. Inadequate drainage due to a narrowed space between the iris and cornea. Other variations include secondary glaucoma, normal tension glaucoma, pigmentary glaucoma, and congenital glaucoma in infants. How is glaucoma diagnosed? Glaucoma tests include dilated eye exams, gonioscopy, optical coherence tomography, OCT. Ocular pressure tests, pachymetry, slit lamp exams, visual acuity tests, and visual field tests. What are the treatment options for glaucoma? Treatment may involve eye drops, laser trabeculoplasty, microsurgery, and oral medications to lower intraocular pressure. Laser procedures are crucial for acute angle closure glaucoma. Congenital glaucoma in infants often requires surgical intervention. How can one live with glaucoma? Managing glaucoma involves regular exercise, a nutritious diet, medication adherence, caution with contact lenses. Quitting smoking, monitoring caffeine intake, maintaining proper hydration, and protecting the eyes during specific activities. Adequate sleep is also essential. Can glaucoma be prevented? While glaucoma itself is not preventable, early detection through regular eye exams significantly reduces the risk of irreversible eye damage. Lifestyle modifications, awareness of family history, adherence to prescribed instructions, and protective measures contribute to prevention. What does a comprehensive approach to glaucoma involve? A comprehensive approach includes medical interventions, lifestyle modifications, and emotional support. Regular eye exams, awareness of family history, adherence to prescribed instructions, lifestyle modifications, and protective measures are crucial components of proactive eye health. Conclusion. In conclusion, glaucoma presents a significant challenge as a progressive condition affecting the optic nerve, often leading to irreversible vision loss. Understanding the causes, risk factors, and hereditary aspects of glaucoma is crucial for timely diagnosis and intervention. Regular comprehensive dilated eye exams, especially for high-risk groups, play a pivotal role in managing this condition. The hereditary component of glaucoma underscores the importance of familial history, with first-degree relatives carrying a higher risk. Genetic mutations have been identified as contributors to glaucoma development, emphasizing the need for vigilance in families with a history of the condition. Two primary types of glaucoma, open angle and angle closure, present distinct characteristics and symptoms. While open angle glaucoma is more common and manifests later in the disease, angle closure glaucoma demands immediate medical attention due to its rapid onset and severe symptoms. The diagnostic process involves painless and brief glaucoma tests, including dilated eye exams, gonioscopy, and optical coherence tomography. Timely and accurate diagnosis is essential for initiating appropriate treatment and preventing further optic nerve damage. Treatment modalities for glaucoma encompass a range of interventions, from medications and laser surgeries to microsurgery. The choice of treatment depends on the type and severity of the condition. Acute angle closure glaucoma, being a medical emergency, requires swift laser procedures to avert irreversible vision loss. Living with glaucoma involves a commitment to lifelong management, including regular follow-ups, medication adherence, and the adoption of a healthy lifestyle. Lifestyle modifications, such as stress management, proper nutrition, hydration, and adequate sleep, complement medical interventions and contribute to overall well-being. Supporting a loved one with glaucoma, especially older individuals, requires emotional reassurance and practical assistance, such as helping with eye drop administration and facilitating transportation for medical appointments. While glaucoma itself is not preventable, early detection significantly reduces the risk of irreversible eye damage. Regular eye exams, awareness of family history, adherence to prescribed instructions, and lifestyle modifications, including regular exercise and protective eyewear, form crucial components of preventive measures. In essence, a comprehensive approach to glaucoma encompasses not only medical interventions, but also lifestyle modifications and emotional support, fostering a holistic and proactive stance toward eye health. Your health matters. Quali.health